We're moving from the back of the eye to the front of the eye. You guys went, no, I did a lecture on macular degeneration. That's in the back of the eye in the retina. Then I did a lecture on cataracts, which takes place in the lens. And today we're going to talk about the cornea, particularly about an eye operation that shaves and reshapes the cornea. Now, you'll notice the cornea is a perfect dome. What happens during LASIK, which is a cosmetic, unnecessary operation, the only reason to do it is to change the focus of the eye so you don't need to wear glasses or contact lenses. But it shaves off part of the cornea using an excimer laser. And this means that the cornea, instead of having this beautiful curve, goes up and flat and down. It goes from being a perfect curve to being a mesa shape. And I was there the day LASIK was born. I was up at the Harkness Eye Institute of Columbia Presbyterian Medical Center and working away with patients. The attending doctors all worked right next to the patient, to the residents seeing patients. And Steve Trocal came rushing into my room. He said, "Look at this." He shoved a piece of paper in my hand, and it showed a cornea that had an exact rectangle sliced out of it. He said, "This was done with an excimer laser. It's going to revolutionize ophthalmology. It's going to eliminate the need for glasses." And I thought Steve had gone completely out of his mind. I almost laughed. The cornea has more nerve endings than any other part of the body. If you're going to cut through the cornea, you're going to cut through all these corneal nerves, and you're going to get terrible pain. I knew that. How many of you have gotten a piece of dust in your eye? How many of you have ever had a scratch in your cornea? It's excruciating, right? Now imagine, instead of just being in one little spot, it's all over the eye, it's all over both corneas, and you cannot treat it, and it's permanent. The other thing I knew was this is going to thin the cornea. It's going to make it weak. And I was absolutely right. There's a dreadful disease called ectasia, where the cornea after LASIK starts to bulge out in the thinned part, and you can't really transplant it because after you have LASIK, you have chronic inflammation in the cornea, which you can see on scans for the rest of your life. So if you try to do a corneal transplant, it'll fail. And I said to Steve, this is never going to work. It's going to be a disaster. I was so wrong. Why are people still having LASIK, even though a first-year eye resident can tell you if you cut the cornea, you're going to have scarring, you're going to have pain, you're going to have distorted vision, and 100% people will have trouble seeing at night. Why? Well, this part of the cornea will have the same focus that it had before, not on the retina. The center part, corrected by the laser, is going to focus right on the retina. And this part's going to also focus in front of the retina. So every time the pupil dilates, so every time you're in dim light, you're going to end up with quadruple vision, glare, halos, starbursts, 100%. Also, this is going to heal through scarring. That's how the cornea heals. You get a scratch on your cornea or a herpes infection in your cornea, and it heals with a scar. So the vision is never going to be as good. Bottom line, after LASIK, 100% of people who have LASIK have loss of contrast sensitivity. So before I go any further, I'm going to talk a little bit about eye lasers. And boy, do people get confused about eye lasers, because there are 5 lasers we use in the eye. The excimer laser, which we use in LASIK, is only one of them. The excimer laser is able to etch surfaces with incredible precision, which is the reason it's used to make microchips. I mentioned the other laser, the second laser, the femtosecond laser, when we talked about cataracts, which is an opacity in the lens. The femtosecond laser is unnecessary. It's not needed to have a good result, and it's more expensive for the patient and more profitable for the surgeon, but at least it doesn't do any harm. The other 3 lasers used in ophthalmology have saved the sight of millions of people around the world. In other words, the type of laser and where it's used in the eye is what's important. There's the argon laser, which is used to treat the retina in the back of the eye. That's saved the sight of millions of diabetics around the world. There's the selective laser, which is used to treat the drainage angle of the eye. And an abnormality in the drainage angle of the eye is what causes glaucoma, because the pressure in the eye goes up and kills the optic nerve. And then the third laser is the YAG laser. If any of you have had cataract surgery and then you developed a cloudiness in the back capsule of the lens after the surgery and had a laser treatment for that, then you've had a YAG laser. All the lasers have different wavelengths. It's a little complicated, maybe. I'll give you a talk on that someday. But don't just say, I never want a laser to be used in my eye. Just say, I don't want an excimer laser to be used during LASIK. So the reason you're seeing a slideshow today, which is fine, is that I couldn't show you the movie, but I will read you what Dana Conroy, about Dana Conroy's experience. And some of the stuff I'm going to tell you may seem incredible to you. You may be horrified, you may not believe me, but I've written a book, I've co-authored a book with 3 other people. This is Morris Waxler, who was head of the FDA committee that approved LASIK in 1999. And then Paula Kofer is a LASIK damaged patient who spends her life helping other LASIK damaged patients. Ed Boschnick is an optometrist who fits contact lenses for LASIK damaged patients, and then me. The back of this book has 11, thank you. Sir Walter Raleigh, thank you. The back of this book has 11 pages of citations from the scientific literature. Every statement I'm going to make today is backed up by a scientific paper, a study. Let me have the next slide. And a big shout out to the people who threw this together. We were up till midnight last night putting these slides together when we realized we couldn't show the movie. This is the Food and Drug Administration. I've been down there twice to testify before them. This is me. This is Paula Cofer, the lady I told you about. She lived in horrible pain. She can't see. We had dinner together. She had to grab my hand. When we walked down the street, she went blind. She couldn't read the menu. I had to read it to her. She couldn't cut her food. I had to cut it for her. She started the LASIK Complications Support Group. This is Morris Waxler. He was the man, the head of the FDA committee that approved LASIK. This lady is Dr. Nancy Burleson. She had one child, a son. He had LASIK, and he committed suicide because he had constant pain. He couldn't see. He was disabled. Nothing could be done about it. And he didn't want to live with that. Just last 2 weeks ago, there was a young 29-year-old policeman who committed suicide after LASIK. It's not a joke. And have you ever heard about Pat Tillerson? He was the best that America can produce. He was a National League football player, and he quit this very lucrative career to go into the army. He fought in Afghanistan. He was shot by friendly fire. He was shot by his own troops. He was walking out with his hands up. One of the person had had LASIK a couple of weeks before. He couldn't see. He shot him. And many of celebrities have had disastrous complications after LASIK. One of the Spice Girls, I don't know if you listen to Spice Girls music, totally blind in one eye after LASIK. Jennifer Capriati had LASIK. Do you remember she was this incredible star heading for the heights of tennis? She had LASIK. And remember, with LASIK, you can't see at night because they're two different focus points. She couldn't play at night anymore, and it ruined her. Next slide, please. This photograph was taken in Minneapolis. This is Dana Conroy. She's a PBS documentary producer. And after LASIK, she's severely disabled. I'll read you about her story. This is me. This is the premiere of the film Broken Eyes, which will be shown on PBS soon, I hope. Next slide, please. This slide was taken at the Soho International Film Festival. This is Ed Boschnick, the optometrist in Florida who treats LASIK damaged patients. This is me. This is Dana. Look at her. Can you imagine? This is Paula again, and this is Tammy, another LASIK damaged patient. Now, next slide, please. Let's go through the complications of LASIK. These all come from studies. This study was released in 2024. 75% chance of having dry eye. These come from the original data that the LASIK surgeons gave to the committee of the FDA. This is the original data. After Morris Waxler approved LASIK, he retired from the FDA, and he started to see all these patients whose life had been ruined, families who had family members commit suicide. And he said, something's wrong. He went back to the original data provided by the LASIK surgeons. And the FDA had required that they follow these patients for a year. They originally wanted to not have any follow-up, just to show the immediate effects. And he found that actually, after a year, all these complications that the LASIK surgeons had said, oh, they're temporary, they'll go away, the eyes will heal. These all come from the original data provided to the FDA, and they're at 1 year out. 60% fluctuating vision, 50% glare, 40% sensitive to light, and difficulty driving at night. People with LASIK should have restricted licenses. You're flying in planes with pilots who've had LASIK. You're driving down the street and patients who've had LASIK are driving towards you. They're not seeing your 2 headlights, they're seeing 20 headlights. And 40 million people, 40 million people around the year have had LASIK. That's a lot of people. It's in all the developed countries, and they're all having the same problems. 20 million of them are in the United States. So if 30% of these people are getting life-altering complications, that's 11, 12 million people around the world who've been disabled by LASIK. Next slide, please. Arthur's 12 o'clock, midnight. The LASIK flap never heals completely. There are 2 different kinds of LASIK. LASIK stands for laser assisted in situ keratomylosis. In other words, using a laser, keratomylosis, to change. Kerato means the cornea. In the beginning, the first type of laser that was approved, it was actually something called PRK, where they scraped the top surface of the cornea off to laser the inside and thin it. But that wasn't very popular because it hurt. You imagine you have a corneal abrasion that takes over the entire center of your cornea. That's gonna hurt. And so, a couple of years later, they developed this flap technique. So there's LASIK with flap and LASIK without a flap. But today, when you hear the word LASIK, it mostly means with the flap. They take the eye, they squash it down. The pressure inside the eye goes up to 70 or 80. Normal is 8 to 22. They squash it down. They slice off a flap. They lay it aside. They laser the cornea, and then they put the flap back. And they expect it's going to heal in place. They just put it there. They don't put any sutures on it. It's a slice of the cornea that's been put back. And that flap is only attached with the strength of a contact lens. It's only got 2 to 3% of its normal adhesion. So you rub your eye, you play some contact sports, you go swimming in the ocean, you get slapped by a wave, the flap dislocates. And once it's dislocated, it's much more likely to dislocate again, and you're much more likely to get cells diving down in the middle of the cornea, infecting it, causing crystalline deposits. So I used to tell every LASIK patient that came into my office, you gotta wear goggles when you swim. You gotta wear goggles when you wear when you play tennis, protective eyewear. Here's the laughable part. The cornea is not a piece of plastic. You don't shave it and then that's it. It's alive. It's living tissue. It grows and it remodels. This means that after 3 years, about 30% of the eyes will have grown back again, so the patient will be back in glasses again. After 7 to 8 years, 45% of these people are back wearing glasses. After LASIK, 1/3 of people are still wearing glasses, either distance or near or both. So you're going through incredible pain, a lot of expense, decreased vision, inability to drive at night, to have good vision for 6 or 7 years. We've talked about this, that LASIK thins and weakens the cornea, so you get this outward bulging. And because you're crushing down the eye, imagine how nice that is for the eye, to have the whole eye crushed. It damages the retina. The retina gets stretched. The rate of retinal detachment goes up 60 times. And cataracts come 15 years earlier than normal. Yeah, when you push down, you're not only stretching the retina, you're damaging it. There have been people who've had hemorrhages into their macula, hemorrhages around, so there are little blank spots in their vision, hemorrhages to the optic nerve. The back of the eye is damaged in flap LASIK, just like the cornea is damaged. Let's talk a little bit about consent. I did eye surgery, as you all know, for 40 years. My specialty was laser surgery of the eye. Used the argon laser a lot, the selective laser a lot, the YAG laser a lot. But I always had the obligation to give my patients carb. I had to explain the complications, the alternate therapies, the risks, and the benefits. That's necessary. You have to do that. After every note where I signed a consent, I always wrote down carb. Another thing, many of you here have probably had cataract surgery. And that, you know, one eye was done, and then you waited another 2 weeks, and then you had the other eye done. Guess what? The LASIK surgeons want to do both eyes on the same day. They even give you a discount for the second eye. This is because if you have LASIK on only one eye, you can compare the vision in that eye to the vision in the other eye. Oh my gosh, this eye that has had LASIK, it can't see at night. There's thick glare, there's dazzle, there are halos. It really hurts. I don't want to have my other eye done. So they don't get the other eye done. An eye surgeon goes through 4 years of medical school, a year of internship, 3 years of residency in eye surgery itself, and then most of them take a fellowship. To learn how to do LASIK, you don't have to do that because the laser is doing all the work. All you have to do is punch in some buttons, lay down the patient, open the eye, and go bzzz. The question is basically advanced surface ablation. That just means the laser has programmed a little bit better. You'll read about all these fancy new techniques. For example, there's something called SMILE, where instead of shaving the surface off, they take a lenticle out of the middle of the cornea. They do use the laser and then they pull it out. They say, oh, with advanced techniques, you don't get the complications. Bottle wash. You're still cutting through corneal nerves. You're still distorting the shape of the cornea. The healing is going to take by scarring. There's no way you can reshape the cornea without cutting corneal tissue. When you thin the cornea, you've weakened the cornea. And about at least 1.5% of the time, and it increases with time, the pressure inside the eye makes this thin cornea start to bulge out. And that's what we call ectasia. It's like a hernia. You know, if you have a hernia, you got a bulging of your abdominal wall. It's like a tire that has a spot. There is a hereditary cause of ectasia. It's called keratoconus, where it usually happens in your late teens or early 20s that you start getting this bulge. That's very different from the ectasia caused by LASIK. First of all, there you can do a corneal transplant because the entire cornea isn't inflamed. And that will work well, or treat it with hard contact lenses. But ectasia in a LASIK patient is one of the most feared complications of all, because boy, does it ruin your vision fast. Now, there was a question over here.
Are there any vision correction procedures that you would recommend? And in particular, is PRK just as bad as LASIK?
Well, PRK is, and did you hear his question? Is there any vision enhancement you would recommend? Absolutely, I would recommend glasses and contact lenses. That's the cheapest and the safest and the best way to correct your vision. It's just a focusing problem. The focus is not on your retina. If you're nearsighted, it's focusing before the retina. So you put a lens in your eye and it focuses right on the retina. PRK is LASIK without the flap. Any surgical procedure that reshapes the cornea, and these guys have been very inventive. You know, they're sticking little lenticules into the eye. At one point, they were putting slits around the cornea to flatten, and that was radial keratotomy. What a disaster that was. Anything that reshapes the cornea is going to cause scarring, is going to cause pain, is going to cause distortion in vision, trouble seeing at night, 100%. So glasses and contact lenses is the way to do it.